Sony George to give us some insights on the soft cataracts. So what happens is they look soft and they look very cuddly and nice, but they can be a nightmare for the novice surgeon. So Dr. Sony George, over to you, an excellent left-handed surgeon again with a lot of experience in phaco cases.
Thank you, Dr. Manistry, for the opportunity. Good afternoon. Just one comment on your small pupil IFIS cases. Maybe moving a little anterior instead of the near limbal, if you go little anterior, maybe by 1 millimeter, that also could prevent even the side port from the iris to come out. Okay, from the hard brown, now we go to the soft nucleus. Many of us at some point of time would have thought that soft nucleus is easy, but it is probably harder than dealing with hard nucleus, basically because it is too soft to handle. Okay, and there's a lot of cheese firing, so all the established and defined techniques may not work because of the cheese firing. You may have a lot of corticocapsular adhesions, and because of that rotation, you don't have sufficient hard material to rotate, so that rotation must also be difficult, and there is no single technique which is perfect, so you may have to be ready to shift techniques, although you plan one and go ahead. And the chances of PC damage while sculpting and removal etc. is very high because of the material being very soft. And if it is a small pupil, things become even more worse. Operating a soft cataract in a small pupil is definitely tougher than doing a small pupil hard cataract. And we have to make sure we are ready, like there should be good dilatation. You should be ready with hooks and rings if necessary. A good hydrodissection and a hydrodelineation is very imperative when dealing with these cases. And like I said, be prepared to shift techniques and use slow down whenever needed. And OVDs, generally we think OVDs are necessary only in hard cataracts, but here they are viscoelastic devices. So a few of the techniques, one is the chip and flip, and the stop and chop, and the stop and chip. So most of the time after that you are not able to chop, then you keep chipping, and the lens salute. So these are a few of the techniques. So this is the advantage of a good hydrodelineation. You are able to rotate also. Here instead of in the center, you can just keep rotating from the periphery in a parallel way. And once you go through it, you give a little bit of chipping, remove some of the central nuclear matter, and after that it's very easy to flip. Make sure you have a sufficiently sized rexis also, not too large, but at least 5 to 5.5 centimeters. And then once that happens and things happen and you're able to flip the nucleus into the anterior chamber, I can go ahead with the cataract. Yeah. And yeah, this is another chip and flip, softer nucleus. And yeah, once you get it in one, you can use a second instrument to use the tumble the delineated nucleus into the center. And yeah, this is a soft nuclear lift. Once you go into the center, you can just use the phaco probe and the second instrument to just lift it. Only the endonucleus is lifted up into the center, and with minimum energy you can go ahead and finish it off. And this is a stop and chop. I'm sorry for the quality of the video. Can you cut off the volume? Okay. So this is a slightly harder nucleus, but you cannot, even the rotation is difficult. So once you get and you divide into two, yeah, now you have two fragments. Now things are much easier. Then you keep chipping. Actually, instead of the next chop, you just keep chipping. And yeah, this is what happens. Yeah, although you are not chopping, small fragments are coming through, and you keep rotating. And instead of the whole nuclear heminucleus coming, bits of nuclear fragments keep coming, and you can finish off the case with these. And this is where, if you have a doubt while sculpting, see, here there is a clear area in the center. So you do not know whether it is a rent. So what you do is you immediately use viscoat, go and plug that area. You don't need to remove the phaco probe at all. Once you do that, what you do is you try rotating, keeping the probe inside itself. If it is rotating properly, there is no problem in the rotation. Probably you are not dealing with a rent. And then once you're confident, you go in and start removing the fragments. Once 1 or 2 fragments are removed, then you can have a better view of the posterior capsule and whether there is cortex behind. And then that goes on as usual. And this is the Mohanda chopper which is being used. This is a useful instrument, especially in this thing with cheese wires. So it has got a nucleus sustainer and a chopper. So you sustain you should have a very good hydro delineation and this thing. You rotate the nucleus, make sure it is mobile, and after that you go under the capsular axis and go to the equator with the sustainer, and on the other side you just move the 2 instruments together. Okay. And since there is a lot of it not clearly seen, the division is not clearly seen because of the soft material. But when you start when you go in with the phaco machine, things are much clearer. See, it's already divided. You just need to support and remove the pieces one by one. And here is the lens salute. So here again you do a good hydro delineation, and then you pop out the nucleus by hydroprolapse, just like you do in SICS. Here you need to have a little larger rhexis. 5.5 should be sufficient. And once you get one pole out, then make sure you put sufficient viscoelastic behind the tilted pole also. And once you go in, then again lens salute. Make sure you don't go in with the irrigation on, because you will push the saluted lens back into the bag, and then you start chopping. And this continues. Yeah. Once that is done, you start from you can use the carousel technique if possible. Otherwise, you keep rotating the nucleus and then flip it inside, and then that is the end of the procedure. So in short, these are the few techniques which you can use to make life simple in a soft cataract. And whenever needed, please go ahead and use iris hooks or rings and OVDs in plenty, so that you don't end up in a problem. Thank you very much.
Thank you, sir, for the wonderful insight. I think now we'll have a easier time dealing